Revolution is here. Yeah.
Hey guys, Dr. Jagoda here. Welcome back for part 2 of the treatment of tendonitis. In our last episode, we discussed a little bit the differences between tendonitis and tendinosis. And just to recap, tendonitis is the inflammatory condition of the tendon, whereas tendinosis is more of the degradation or degenerative changes within the collagen of that tendon. So today we're going to discuss how to treat tendonitis conservatively. So most medical treatment would include, non-steroidal anti-inflammatories, which can give you relief, but the typical medical model, I guess you could say, is RICE, rest, ice, compression, elevation, and to some extent that is true. You definitely want to rest the tendon so it doesn't get more inflamed, but you don't want to just completely stop using it. So ice is definitely going to be helpful because this is an inflammatory condition, so therefore you do want to do ice. The compression can help soothe that discomfort. You do not want to use heat for this type of condition. Kinesiotaping is another methodology that you can use to help compress structures and maybe avoid extra tension and strain on that tendon or that muscle group. Finally, or a few things actually, soft tissue structures. You're going to want to do some ART or Grafton in order to really kind of break up some adhesions and reduce adhesions from forming. So there is a little bit of difference of what you want to do in soft tissue structures. And in this case, you really want to prevent any scar tissue from building up in that inflamed area. Finally, we also have rehabilitation and we also have supplementation. When you're talking about supplementation, one of the quick things I recommend right off the top is glucosamine, chondroitin, these other simple things that you've already probably heard of. And I would like to increase essential fatty acids, things like fish oil. So if you're taking 1 or 2 a day, I recommend upping the 3 to 4 to really help reduce that inflammation systemically within the body. And finally, like I said, rehabilitation. The rehabilitation is fairly similar, but you're going to want to start eccentrically loading that tendon. And that really means contracting it during its lengthening phase. So instead of concentric, which is the contraction where the muscle shortens, you're going to eccentrically load that tendon. So therefore, it is going to lengthen as you rehabilitate that kind of structure. Every structure is a little different, so in the next coming episodes I'm going to show you how to eccentrically load each individual structure, okay? So that is pretty much the main treatment of how to deal with a tendonitis. In the next episode we'll discuss how to deal with the tendinosis, and then we'll get on to the eccentric loading. Alright guys, hopefully this clears up a little bit of how to go about treatment of tendonitis. I will see you next week and we'll go from there. Bye.
I just want to innovate and stimulate minds, travel the world. And